Chapter 13, microbe-human interactions. The human body exists in a state of dynamic equilibrium. Okay, all that means is a human body maintains, like I say, a certain body temperature. It goes up, it goes down, but dynamic means changing. Equilibrium means it stays constant. So it's a changing value that stays pretty close to the same. I mean, 98.6 is our temperature, and we can go higher or lower, but it comes back to the original. Okay, we keep our body at a certain status quo, homeostasis. Okay, there's many interactions between the human body and microorganisms that involve the development of biofilms that house organisms attached to the human body and adhere and form their colonies. So colonization of the body involves a constant give and take. Okay, I mean, the microbes use certain parts of our nutrition, okay, and they take a certain part of that away. It's a give and take system in our bodies. Okay, microbes provide a protective and stabilizing effect on body surfaces. Microbes can protect our skin and other bodily surfaces. Microbes are involved in maturation of host defenses and development of the immune system. Okay, so there are very good and healthy microbes which we need to survive that help create this dynamic equilibrium between us and the microbes. Microbes can invade and grow in sterile tissue. That's when you cause disease. Okay, most of the microbes are perfectly fine living on our body, and we do just fine with them. A lot of them break down certain bacteria in our body, certain foods, give us certain vitamins. We need certain microbes in our body. And again, with the abuse of antibiotics, we kill off those good ones also. So microbes that engage in mutual or commensal associated with human beings are normal resident microbiota. Okay, they're the normal ones that occur and the ones that are good to us. They're indigenous microflora or normal flora or commensal, just exist. And when infection is conditioned with a pathogenic microbe, okay, it penetrates our host defenses and enters the tissues and then starts to multiply. It gets through the skin. It gets through our immune system, B cells and T cells, and it starts to get into and multiply. Pathogen, the definition of pathogen is a microbe that acts as an infectious agent. Infectious disease is an infection that causes damage or disruption to our tissues or organs. Okay, so how a microbe gets into the body, you have contact. Okay, adheres to exposed body surface in the nose, roof of the mouth, etc. Okay, and colonization with microbiota. You start to colonize like inside the nasal cavity. Then you get invasion. Microbes cross the line of defense and enter your sterile tissues. They can cross the mucous membrane and like meninges of the brain and for meningitis. Okay, enter into the middle ear, vertigo, inner ear infections. Okay, so the microbes are established in the tissues, but disease is not apparent yet. Once it's apparent, defense holds pathogen in check. Then we can repair the damage or effects of microbes result in injury or disruption of the tissue, and we either get death or sickness can result in that. Okay. And they can get through, like I said, the meninges, middle ear, get through the bronchioles, the alveolus, and the lungs. That's how microbes invade our bodies. Okay. And not all invasions result in problems. Okay, our immune system can fight it and it can wipe it out. Okay, our defense systems can hold it in check here. Okay. But if they do start getting infected, they penetrate the sterile tissues, then we can get an infection. Okay. So internal organs, tissues, fluids are microbe free. Okay, those are sterile environments. Most areas of the body in contact with the outside environment harbor resident microbes. Those are the ones that normally exist that are healthy for us. Okay, transient microbes occupy the body for short times. They're transient. They come and they go. Residents microbes that become established and live within our body as a permanent situation. Okay, there's certain sites that harbor normal resident microbes. Those are the ones that live in the body. Our skin, okay, and it's contained mucous membranes have normal resident microbes. Upper respiratory tract, oral cavity, the pharynx. Okay. The GI tract, mouth, colon, rectum, anus. The outer opening of the urethra, the external genitalia, male and female, the vagina in the female, the external ear and canal, the external eye, eyelids, lashes, and the follicles. Okay, those are all parts of that harbor normal resident microbes. Okay, these resident microbes are generally stable. Okay, they fluctuate with general health, change with age, with diet, with hygiene, different hormones, different hormone activities when you go through like menopause, changes the microbiota, drug therapy. And that can be very dismissed. Any drugs that kills out some of these resident microbes are going to allow more areas for the pathogen of bacteria to now occupy. So that's something you got to be very careful with antibiotics. In many cases, microbiota benefits hosts by preventing overgrowth of these harmful microbes. It uses up a lot of the nutrients that it needs, so it's not available for the pathogens. Okay, this is called microbial antagonism. We conjunction together for the benefit of both the resident microbe and the organism. Endogenous infections occur when normal flora is introduced to a site that was previously sterile. So now if there's a break in the protective barrier, okay, then you get infections from what's normally healthy bacteria getting the areas they're not supposed to get into. And that can cause infection. These are the microbe-free anatomical sites. Your heart, circulatory system are free of microbes. Your liver, kidneys, lungs, brain, muscles, bones, ovaries or testes, glands, sinuses, middle inner ear, and the internal part of the eye. Those are normally microbe-free. If one of those barriers break down, then you can have an infection develop. Fluids within organs or tissues. Fluids, these are resident microbes that are the blood is microbe-free. Urine in kidney, ureters, and bladder. Cerebrospinal fluid. Saliva prior to entering the oral cavity, and semen prior to entering the urethra. Okay, the uterus and contents are normally sterile until just before birth. Breaking of the fetal membranes exposes the infant to the different bacteria. Subsequent handling and feeding of a newborn continues to induce would be normal flora. Nature of the microbiota initially colonized large intestine is influenced whether the baby receives breast milk or formula. Okay, so when they're born, they expose baby to bacteria, breast milk or formula exposed to different things. Handling the baby with around different people is going to expose them to different flora, and they're going to develop that as part of their normal immune system, which they need. Okay, this tells you the different anatomical sites and the different bacteria present. Okay, so if you take the skin, for example, you have bacteria, fungus, or arthropods. Okay, these are microbes that live only in upper dead layers of like the epidermis of your skin. Okay, depend on skin lipids for growth, fats. The GI tract, oral cavity, these are different bacteria that inhabit it. They colonize the epidermal layer of cheeks, the gingiva, the pharynx, surface of the teeth, found in saliva in huge numbers. Some of these cause dental caries. Streptococcus viridans does, but it's not listed on there. Okay. Albicans, the fungi causes thrush, which we treat with nystatin, which we talked about before as an anti-fungal drug. Okay, protozoa inhabit the gingiva with poor oral hygiene. Large intestine and rectum. Okay, gastrointestinal tract. Have sparse or non-existent residents of microbiotics. Okay, upper respiratory tract. The bronchi, bronchioles, alveoli. They usually still do local host defenses. Genital tract also, females. Okay, vaginal colonists respond to hormonal changes during life. Urinary tract. In the eye, the lids and follicles harbor similar microbes as the skin does. Okay, the conjunctiva, which is the outside part of the eye, has a transient population. Deep tissues of the eye, the vitreous humor, stuff like that behind the eyeball and the lens are sterile. The ear is similar to the skin. The extra part of the ear is similar to the skin and content. All right, so colonizers of the human skin. The skin is the largest organ of the human body. It's most accessible. It's one that's exposed to our environment more than any other one. Has two cutaneous populations. Has transients, which are short-term. They clean to the surface but don't grow there, and they're influenced by hygiene when you wash them off. Residents, ones that live there, they're stable, they're predictable, they're not influenced by hygiene as much, and then primary bacteria and yeasts. Okay? These are the layers of the skin, and these upper layers is where these bacteria survive. It's in the epidermis. You have your epidermis, your dermis, and your hypodermis, or your subcutaneous tissue. Right? These are your sweat glands that come up and excrete through the surface. This is your hair root, hair follicle, and then you have oil glands or sebaceous glands associated with the hair. So it gives you oil feeling of your hair. And then you have sweat pores on the skin to cool the body surface. Okay, you can see on the skin, you see the bacteria harboring, forming colonies as biofilm on the skin. GI tract. GI tract is a long, hollow tube. Okay? And it's bound by mucous membranes. This tube is exposed to the environment because of the foods we eat. Okay? All the bacteria in the food we eat gets into the GI tract. So you have a different vary in the flora distribution because of the foods that we eat. You have shifting conditions. The pH changes, oxygen tension changes. You have different types of anatomy. The oral cavity, large intestine, and rectum harbor a lot of flora because of the bacteria in our food supply. Okay. Here's our GI tract, the oral cavity, into the pharynx, into the esophagus, into the stomach, goes through the duodenum, small intestine, duodenum, jejunum, and ileum. Then feeds into the large intestine, goes through all the small intestine. Okay, feeds into this is the, I dropped my on the word, the beginning of the large intestine. Okay, it's where the appendix is found, behind that. This is your ascending colon, your transverse colon, your descending colon, your sigmoid colon, and into the rectum as it passes through the large intestine. Oh, the cecum, that's what I was trying to think. This is the cecum of the large intestine. That's where the small intestine empties in the large intestine. That's where your appendix is found. Okay, the microbiota of the mouth is the most diverse and unique flora of the body. Why? Because everybody eats something different. And they all have different microorganisms in the mouth. There's numerous adaptive niches in microhabitats, all kinds of areas of the mouth. You have cheek epithelium, you have the gingiva, you have the tongue, you have the floor of the mouth, and you have tooth enamel. Most common are aerobic, Streptococcus, Strep sinus, Strep salivarius, and Strep mitis. These are all the ones that normally occur in the mouth. These are non-pathogenic. Teeth eruption establishes an anaerobic habitat in the gingival surfaces. We talked about it a little bit before last time. Here's your gums, and as your tooth pokes through, okay, this is our tooth here. This is all intact, so bacteria can't get in here. Now, as a tooth pokes through, goes through the gums, now you have gums, and you have a tooth coming in. You have a tooth that's erupted into the mouth. And I'm not a great artist at all, but you have the gum here that comes around, and these are little pockets that form around the tooth. That's where gingivitis is and periodontal disease. And what happens is these pockets are without oxygen. They seal off the oxygen. So the bacteria that develop in these pockets are anaerobic. So they're without oxygen. So we can get rid of the bacteria, which is like with hydrogen peroxide, things that produce oxygen to help kill those bacteria. Okay. Bacteria count to a saliva is 5 times 10 to the 9th, which is a huge number, cells per milliliter of saliva. A lot of bacteria in saliva. Large intestine, complex and profound interactions with the host. Okay, 10 to the 8th to 10 to the 11th microbes per gram of feces that are developed. Okay, intestinal environment favors anaerobic bacteria. Oxygen to your large intestine. Okay, microbe of the large intestines, a lot of them provide useful byproducts for the host. Fermentation of waste in the feces generates vitamins like B12, vitamin K, pyroxene, riboflavin, thiamine, a lot of the B vitamins. Okay, they're all generated by bacteria in our intestines. So those are the good bacteria. Those are ones you don't want to wipe out. Okay, so as I say, you got to be very careful with antibiotic therapy. It's not going to hurt the attitude anymore. It used to be. We can't do that anymore. Bacterial digestive enzymes that convert disaccharides, which are 2 sugars, to monosaccharides. That's what we use to store. Okay, promote steroid metabolism. Okay, intestinal bacteria contribute to intestinal odor, the smell of the feces. Oral streptococci is the first organism to colonize in the respiratory tract. Okay. You have the nasal entrance, the nasal vestibule, and the anterior nasal pharynx, and the Staphylococcus aureus. Mucous membranes of the nasopharynx, of the Neisseria species, and the tonsils. Okay, and lower pharynx, streptococci, and hemophilus. There's no fluor in the bronchi and the lungs. Okay, we don't have fluor that go down into there. There's no benefit for it. Everything's kept clean in the lungs. If infections get in there, then you can have serious trouble. Okay, there's your nasal entrance here, nasal vestibule as it goes down. Sinuses are up above it, goes into the nasal cavity. The internal nares opens up, a soft palate is at the back of the mouth there. Flows into the nasopharynx, then into the larynx, into our esophagus. Esophagus runs back down here. This goes into the epiglottis, covers over the trachea, because this goes over the opening to the esophagus and the trachea. The trachea is anterior to the esophagus. Okay, there's a flap of tissue called the epiglottis, which folds over the trachea. So when you eat something, it goes down the esophagus and doesn't go into your trachea. You ever have your mom tell you, don't talk with your mouth full? Pay attention. Because if you're talking, air is being pushed up and that epiglottis is open. And then you can choke, stuff can get into your lungs, which is not a good thing. So it flies into the trachea, and from the trachea, it goes into the right lung and left lung. And you have the bronchus, it's the main branch, and the bronchioles are the smaller branches, and they branch into the alveoli where air exchange occurs. Okay. Genitourinary tract. Okay, females, you have the vagina and the outer opening of the urethra, and in males, you have the anterior urethra. Internal reproductive organs keep sterile by physical barriers. Okay, the kidney, ureter, bladder, upper urethra keeps sterile by urine flow and bladder empty. It keeps the pathogens moving through the body. Changes in physiology influence the composition, influence it. In the vagina, estrogen changes, glycogen, sugar content, and the pH. Okay, microbiota of the genital tract in females and in males. Normal flora is essential to the health of humans. It makes certain vitamins that we cannot produce on our own. Okay. Flora creates an environment that may prevent infections and can enhance our host defenses. If the healthy bacteria is in place, pathogens can't get through. Antibiotics, dietary changes, and disease alter the normal flora. You don't want that, okay, unless it's for the better. Okay, some dietary changes are good and are healthy to prevent pathogens and increase the normal healthy flora. Probiotics introduce known bacteria back into the body. Yogurt, different things that occupy good healthy bacteria, introduce those back into the body. So the normal resident microbes are absent from where are they absent from?
The lungs.
The lungs, perfect. The lungs are sterile. You got it. Exactly. So major factors in developing an infection. You have to find a port of entry. Like we said, it's got to get in there. You've got to break down one of the barriers to get the infection in. And it can go through the skin, go through the GI tract where you're ingesting pathogens. It can go in the respiratory tract where you're breathing in. Tuberculosis is one example of a respiratory infection. Whatever you breathe into your lungs. Urogenital tract and endogenous biota. The bacteria that are normally in your body can break through a barrier and then be exposed to an area they're not supposed to be in. That can cause an infection. Bacteria attach firmly by fimbriae, which is a little finger-like extension material to attach to where it's not supposed to be. Go through capsules. Surface proteins can bind. Viral spikes can lock onto different cells, and different hooks in bacteria can lock into a cell. So that's how they attach firmly and they get a port of entry. Surviving host defenses. Avoiding phagocytosis. One of our host defenses is to find a pathogen, identify it, and dissolve it. The phagocytosis is the eating of pathogens. So they want to have to avoid being eaten. It's like Pac-Man. They have to avoid death inside a phagocyte. They have to avoid being destroyed once they're inside a phagocytic cell. And you have to evade the actions of the immune system. You have the B and T cells that circulate through the blood and have little markers that try to identify or tag certain bacteria. They have to avoid those. Causes of damage and diseases. Direct damage can be toxins, enzymes, or lysis. Can get into areas that open those up where bacteria are normally not present, where there's sterile areas. Indirect damage. Host response is inappropriate or excessive. Our host response is so bad, it destroys everything there, not just bacteria, but it starts to destroy our own bacteria. Autoimmune diseases are just like that. The response is excessive. We destroy our own cells. So then bacteria can get in, or it can be not efficient enough and bacteria can get in. It can't be too little or too much. Exiting host. Okay, you gotta be able to exit it. Respiratory tract, breathe it back out. Salivary glands, you can sweat it out. Skin cells come back to the skin. We can eliminate fecal matter, urine, or we can get into the blood. It can be stored there. Okay. There's factors that weaken the host defense and increase. If you weaken our host defense, you're going to increase the susceptibility to infections. One of the big ones is old age and extreme youth. Newborn infants are very susceptible to infection. Our older population, okay, our geriatric population is more susceptible to coronavirus, to influenza, to the flu than the healthy population. Okay, genetics, okay, can play an effect in your immunity. After surgery or transplants, kidney transplant, lung transplant, you're more susceptible to infections. Okay, organic disease like cancer, liver malfunction, diabetes makes you more susceptible to infections. Chemotherapy suppresses your immune system. You suppress the immune system, you don't get a good response. Makes you more susceptible to infection. This is what people don't really understand. Okay, stress. Stress plays a major role in a tremendous amount of infections. You can be healthy with everything else. If you are under tremendous amounts of stress, your propensity for getting sick is increased tremendously.
Yes, my friend, she created within herself an autoimmune disease due to stress. She created alopecia, where her hair actually started falling out.
Yeah.
And they said it was an autoimmune disease. The doctor said it was linked to stress, I guess.
Right. My sister did the same thing. Her hair started falling out from stress, from alopecia. It doesn't, in most medical offices, people tend to bypass that when they shouldn't. They want to look for something physical that they can put in their tests that say, this is what's causing it. And stress causes a lot of diseases. If you eliminate, there's a normal amount of stress and that's good for you. You normally have to function, your body gets stressed in doing things. When you lift weights, you stress your muscles, you stress your lungs, and that's a good kind of stress. But stress constantly over financial problems, over marital problems, is going to destroy your body. It really is. And it's not considered when it should be, I guess what I'm trying to say. Okay. And then other infections can do that. So these are all things that can create an increased susceptibility to an infection, okay, because it weakens the host defenses. All right, major developments in infections are true pathogens. True pathogens are capable of causing disease in healthy persons with normal immune defenses. So in a normal person with no pre-existing conditions, surgeries, cancers, things like that, a true pathogen can cause disease in a healthy person. Influenza, that's where you get the flu shot. Okay? Influenza can affect healthy, I don't want to say, but quote, normal people. Okay. Plague bacillus, malaria. Okay? Those can all be caused infection in normal people. Opportunistic pathogens. Okay. Those cause disease when the host defenses are compromised. They exploit that break in the defense. They grow in part of the body that's not natural to them. Those are opportunistic. They take advantage of a break in the host defense system. Okay. Pseudomonas and Candida albicans, a fungal infection, can do that. So true pathogens and opportunistic pathogens. Severity of the disease depend on the virulence of the pathogen, how strong the pathogen is. The virulence factor is a structure that contributes to the ability of a microbe to cause a disease. How quick or how strongly it can cause that disease is its virulence factor. If it's very virulent, it can cause a mass disease in the host. Portals of entry. characteristic of microphiles enter into the tissue of the body. You can get exogenous agents or endogenous agents. Exogenous agents exist from outside the body and then enter it. Endogenous agents already exist in the body and break through an opening through a mucous membrane into the sinus, something like that, but they already exist in the body. So exogenous agents come from outside source, endogenous agents come from inside the body. Okay, so the conjunctiva of the eye, okay, is the port of entry, the respiratory tract, the ear, the skin, urogenital tract, pregnancy and birth. When the baby's born, there's a lot of bacteria that can be introduced into the organism. Portals of entry, you have the skin. Through the skin, you can have nicks in the skin, abrasions, punctures, and different incisions that can go into the skin here. Gastrointestinal tract can go through food, drink, ingested materials. Respiratory tract could be oral and nasal cavities, how different microbes can enter the body. Urogenital tract can be from sexual displaced organisms, okay? Or transplacental, can cross the placental barrier. So different ways and different entries that microbes can enter into sterile areas of the body and cause infections and cause problems. Okay, this is the estimated number of cases of most common sexually transmitted diseases, STDs, in the United States. The biggest one we have for STDs in the United States is human papillomavirus with 14 million cases. That soars above everything else. Trichomoniasis, chlamydosis, here's the herpes simplex, 510,000, gonorrhea, 335, hepatitis B, 40,000, new HIV infections, 35,000 every year, and syphilis, okay, 21,000. So that gives you an overview of the different types of cases we see in the United States of the STDs that we have. Okay, there's one called Storch. Storch is an abbreviation. Okay, these are diseases that can affect during pregnancy. Okay, the S stands for syphilis. The T is toxoplasmosis. The O is other diseases like hepatitis B, AIDS, and chlamydia. Okay, the R is rubella. The C is cytomegalovirus, and the H stands for the herpes simplex virus. Those are all pathogens that can severely affect the fetus as it's developing. Can have disastrous effects. And the abbreviation is Storch. Okay. Infectious diseases, when something infects you, has a minimum number of microbes that require infection to proceed. Okay. You have to have a certain number of pathogens, certain number of these bacteria or microbes that are going to cause the disease to occur. Okay. So microbes with small IDs have a greater virulence. They don't need a whole lot to cause infection. Lack of infectious disease will not result in an infection. So if you don't get, you can have the microbes, but there's not enough to cause the disease, you don't have that minimum number, you're not going to get an infection. Okay. Now, something's real interesting. You'll notice with measles, the minimum number of microbes is 1. Okay, that's kind of amazing. One little virus. And the measles are going to, your respiratory tract, it's in respiratory disease, you will get the disease. You get the infection just on one, and you know how small viruses are. Just one of them. Shingles is 1 to 10. Gastrointestinal, 18 viruses or less. Tuberculosis, respiratory disease, it's 10 to 50 cells. Okay. Smallpox, 10 to 100. The plague, bubonic plague, requires 100 to 500 cells to be infected. Gonorrhea is 1,000 cells. Anthrax, okay, remember anthrax, the big scare we have with people bringing anthrax to mail. It takes 8,000 to 50,000 spores to become infected. Salmonella is 10,000 cells. Cholera is 100 million cells. Okay. So cholera takes a lot of cells to be infected, whereas like measles, just one virus. Okay, and the least it takes, the more virulent the strain is, the more it's going to cause infection. Okay, it has to, when the pathogens get in the body, they have to adhere to something. They have to adhere to the cell. They got to stay transit into the cell. And this adhesion is done in several different ways. So microbes gain a stable foothold at the portal of entry. When they come in, okay, it's dependent on binding between the specific molecules, the host, and the pathogen. Okay, they have fimbriae on the outside. Those are little fields outside that can stick to different cells. A flagella can move the cell around and can adhere to cells. Glycolics are proteins that are found in the cell membrane. Cilia on the side, they have little suckers that hold on to bind. They can have hooks or they can have barbs that actually grab hold of the host cell and can cause infection. So there's different ways they can adhere to the cell. Okay, and this is just a summary of the different types of adhesions you can get with different microbes. Gonorrhea, okay, is a pili attached to genital epithelium. Okay. E. coli causes diarrhea. The fimbriae adhere to the cells. Mycoplasma, which is pneumonia. Okay. Specialized tips fused to the lung epithelium. Encephalitis, okay. Treponema, the tapered hook embeds in the host cell, actually hooked to the cell and transmit the disease that way. Influenza, that's our influenza virus, that's the flu. Okay, the viral spikes dock to respiratory receptors. So they have these spikes that stick in to the respiratory receptors. Poliovirus, okay, it has a capsid around it that surrounds the cell and it attaches to receptors on the target cell. Okay, in HIV for AIDS, okay, you have a viral spikes that stick out and adhere to white blood cell receptors. That's why AIDS affects your immune system, because it decreases your immune system because it adheres to the white blood cells through these spikes. Okay. So invading bacteria have to become established. They have to get in somehow. They can do, one of the ways they get in is exoenzymes. Exoenzymes is your bacteria's out here, and it produces exoenzymes that come outside the bacteria and it dissolves and it breaks down this barrier, this cement layer right here between cells that hold them together. It breaks that down so the bacteria can enter into sterile areas. Okay? So bacteria produce extracellular enzymes that dissolve barriers and penetrate through and between cells to invade into the underlying tissue. Okay? That's one way of doing it. Those are exoenzymes. Another way is with toxins. Okay? Toxins, bacteria damage the target cell. The target cells die and slough off, exposing this underlying area now. And the bacteria can now get into the underlying area by killing the cells through toxins, rather than just breaking through between them. Okay? You can have blocked phagocytic response. Now remember, our response to bacteria come into the bloodstream, the B cells and T cells find them, they engulf them, and they phagocytize them, okay? They're phagocytic, they eat them and destroy these cells. Now, some bacteria will have a capsule around them. So when the cells try to engulf them, they can't do it. The capsule doesn't allow them to be incorporated into the cell, so they can't be destroyed. So the bacteria free move around and invade the tissues. That's a third way of doing it. So bacteria have a property that enables it to escape phagocytosis. That way they continue to grow and cause further infections. Okay. So this is how you can have invading tissues. You have adhesion by the fimbriae. See all the fimbriae on the outside of the bacterial hill? That adheres to the cell. Once it adheres to the cell, it can release a proteins that break this layer down between them, and it can inject into the cell. Okay. You can have these villi on the cell that actually engulf the pathogen. Now the pathogen is completely inside the cell. Okay. Causes the loss of microvilli on the outside of the cell. Okay. It multiplies internally and then exits the cell underneath, causing a systemic infection. Okay, it's going to be engulfed by the cell and travel through it, multiplying as it goes through the cell. Okay, so invasion factors we talked about, like Salmonella, has a unique system that to invade intestinal cells. Salmonella causes food poisoning. Okay, after adhering to the cell's microvilli with its fimbriae, okay, it injects protein into the cell, like we saw in the picture before, like a probe-like substance. So the proteins injected, they break down the actin filaments in the cell and cause the cell membrane to form a series of ruffles, okay, that surround bacteria and pull it inside the cell. It becomes shielded within a vacuole, which is a space around that incorporates in the cell. And it can gain entrance to nearby tissues from there by leaving the other side of the cell. Okay. Bacterial toxins, we talk about toxins. Toxins, by definition, are a specific chemical product of microbes, plants, and some animals that has poisonous effects on other organs. So it actually destroys or kills the cells, opening up now a pathway for the bacteria to get in. Toxinosis is by definition the adverse effect of toxins, what toxins cause. Toxemias, when a toxin is spread by the blood from the site of infection. So this toxin can travel. The toxin gets in, goes in the cell, gets into the bloodstream. That's when you have toxemias, okay, like septicemia, okay, where the toxin gets into the bloodstream and it travels. This is tetanus and diphtheria. Intoxications caused by ingestion of the toxin, like botulism. Okay, we can cause that by ingesting the toxins. Botulism, this is from Botox. Okay, everybody remembers we use Botox for a lot of things, remove wrinkles from the skin. You gotta remember, Botox is one of the most deadly poisons that we know of, extremely poisonous. Okay. Different types of bacterial toxins. We talked about endotoxins and exotoxins before.
I'm sorry, did you say Botox?
Yeah, this is botulinum toxin. Botulinum toxin is Botox.
And it's the most toxic?
It's one of the most poisonous. It's one of the highest, one of the strongest poisons that we know of. Extremely poisonous.
But don't people like use that all the time and put
Get
injections?
injected in their face all the time to get rid of wrinkles. Okay, what it does is it paralyzes you. When you inject it into your face, it paralyzes the muscle can't contract, that we can't cause wrinkles. That's how it works. Botox is extremely deadly poison. Extremely deadly.
Wow. What if it enters the bloodstream? Can it like cause?
Yeah, it can cause problems.
Wow.
It's not supposed to enter the bloodstream. Well, we use it for wrinkles. We use it for migraines to paralyze it, but it's a neurological poison. It causes the muscle it paralyzes it. If it gets to a respiratory center, it'll paralyze any muscle. But yeah, you don't inject that into bloodstreams. It's a really interesting poison, how it works. We have a very cosmetic society, cosmetically concerned society.
Yes,
When
definitely.
they check that stuff in. It's extremely interesting, yeah. But that's botulism toxins, that's Botox. All right, so two types of bacterial toxins, endotoxins and exotoxins. Endotoxins are not secreted. They're released after the host cell is damaged. Then they can be released in. They're composed of part of the outer membrane of gram-negative cell walls. Exotoxins, those are secreted by a living bacterial cell into the infected tissue. So endotoxins stay in the cell. When the cell's damaged, then they're released. Exotoxins are secreted by the living cell. Okay, they're strongly specific for a target cell, and they disrupt its membranes. Okay, hemolysins disrupt membranes of the red blood cells. They break red blood cells. AB toxins are active binding toxins. So the difference between endotoxins and exotoxins. Endotoxins stay in the cell till the cell is damaged, get released. Exotoxins are released by a healthy cell. Okay, so here's all the exotoxins being released by the cell, and it can travel to the heart, the brain, meningitis, all kinds of areas, intestinal tract. So target organs are damaged, damages heart muscle, come down to blood cells, intestinal tract, can have dysfunction from these endotoxins, exotoxins that are released, or the endotoxins when the cell ruptures. Okay, physiological effects of these endotoxins, okay, when they're released after the cell ruptures, can be fever, malaise, just lack of any kind of energy, aches and pains. The body can go into shock if it's released enough of them. Okay, there's different, this is a chart comparing different exotoxin and endotoxins. In forms of toxicity, exotoxins that are released by the cells are toxic in very small amounts. Okay, endotoxins, it takes a lot more of those to be toxic because those are only until after the whole big buildup of them inside the cell. How they affect the body? Exotoxins, they're specific to a cell type. They'll attack the blood, like red blood cell. They'll attack the liver, they'll attack nerve cells. The endotoxins are more systemic, they're less specific. They generalize, go throughout the body. Okay, systemic, and fever, inflammation, weakness, shock. Chemical composition, exotoxins are very small proteins. Endotoxins are lipopolysaccharides of the cell wall. Okay, heat denaturization, 6 degrees centigrade. Their exotoxins are very unstable. Okay, the endotoxins are stable after they're released. They can be exotoxins can be converted to toxoid, which are toxins we use in a vaccine. Endotoxins cannot be converted to toxoids. The immune response, stimulant and antitoxins. Okay, we have an antibody to it to fight against it. This does not stimulate antitoxins for antibodies, endotoxin. Fever, usually not with exotoxins. We usually do have a fever with endotoxins. So it's more general in its effect, causing us a fear throughout the body. The manner of release, remember it's secreted, exotoxins by definition are secreted from a live cell. Okay, endotoxins are released only after the cell starts to die or lysis or is damaged, and then the endotoxin is released. A few gram positive for exotoxins, there's a few gram positive and gram negative bacteria. Okay, the endotoxin is all gram negative bacteria. Okay, so now if it's an endotoxin, it's going to be gram negative. It's an exotoxin, it could be some gram positive and some gram negative. Okay, diseases of exotoxins are tetanus, diphtheria, cholera, anthrax. Endotoxins, meningitis, endotoxic shock, salmonella. All right, true or false? Only gram-positive bacteria can secrete exotoxins. Remember exotoxins?
Isn't it false?
Here's our exotoxins. This is false. Gram-positive and gram-negative, right? Okay, so this would be false. Right? Because gram-positive and gram-negative secrete exotoxins. Endotoxins is only gram-negative. Very good. All right, there's 4 distinct stages of clinical infections. There's an incubation period. There is a prodromal stage. There's a period of invasion, and there's a convalescent period. Those are your different phases of infection. In the incubation period, okay, initial contact is made with the infectious agent. Okay, you get the appearance of the first symptoms. The agent starts to multiply. Damage is insufficient to cause symptoms, several hours to several years. So depending on this incubation period that you get the infection, and it's not quite enough to start your symptoms yet. Okay, you're not getting complete symptoms, and this can last several hours to several years. It can lay dormant. The prodromal stage, you get that feeling of discomfort. You're starting to feel bad. You get this non-specific complaints. Then the period of invasion, this multiplies at high levels. The virus or the bacteria or the microbe goes crazy, becomes very well established. You get more specific signs. Specific things hurt. You get fever. You get different symptoms of the disease. Okay. After that, then you get a convalescent period. You begin to respond to the infection, and the symptoms start to decline. You start to get better. So those are your 4 stages of infection. So here's your incubation period. Bacteria adheres to you, gets in there. It's still not enough numbers to cause symptoms. You're asymptomatic. Then you get the prodromal stage. You start to multiply, and you start that achy feeling that you know something's not quite right. Okay. Then you get the period of invasion, which bacteria go crazy. They start to multiply, tremendous numbers. You get sick. You have all your symptoms. You have runny noses, vomiting, nausea, constipation, whatever the symptom is. Okay, that's right. And then after that, your body starts responding. Antibodies, immune system kicks in, and you start to go into the convalescent period where you decrease the amount of the microbe, and you start to feel better. So there's your 4 phases. Okay, you have different patterns for an infection. You can have a localized infection. A localized infection is where the microbes enter the body and remain in a specific tissue. They enter into the kidney and they stay in the kidney. That's localized. They enter into the lung, they stay in the lung. It's a localized infection. A systemic infection, it starts to spread. Okay, it gets into the bloodstream and it can go from your lungs to your intestines, from your intestines to your kidneys, kidneys to your heart. I mean, it can travel throughout. Okay, that's a systemic infection where it travels throughout the body. Okay? And that's when you get dangerous. That's like the big problem with cancer cells, with how cancer is created, they know class 1, 2, 3, 4, is whether it spreads or not. Okay? A lot of times we'll find with dentistry, we'll take Panorex and we'll see a lesion in the jawbone. Okay? And from that lesion, you may be able to identify it from breast cancer, because one of the main primary sites for breast cancer comes from the jawbone, from cancer in there. So things can spread systemically through the bloodstream or through the lymphatic system. You can get a focal infection when infectious agents break loose from a local infection and carry to other tissues. Okay? Like not a cyst, what's the word? I'll think of it in a second. It goes to block your lungs. It can block into your leg vein, like a clot that breaks loose. Okay, so focal infection, it breaks loose and goes to another tissue and affects it there. Okay? You can have a mixed infection, thrombosis. That's what I'm trying to think of, like a pulmonary thrombosis or something that breaks loose, blood clot, something like that. Same kind of process. Mixed infection is several microbes go simultaneously at the infection line. So polymicrobial, get more than one type of microbe growing. Okay. So according to how it occurs, you have a primary infection or a secondary infection. The primary infection is the initial infection. The secondary infection is a subsequent infection by a different microbe. Okay. We talked about antibiotic treatments. Okay. We talked about the abuse of antibiotic treatments. And we say we don't give antibiotics, we shouldn't give antibiotics for a viral infection. Now, I'm going to give you an exception to that because of secondary infections. If you have a viral infection, the viral infection can weaken the human response, the immune response to the body. So a opportunistic bacteria can take over, and you can get a bacterial infection as a secondary infection to a viral infection. Now you need antibiotics. Now it's appropriate to treat with antibiotics because you have a secondary infection, which is bacterial. Okay, does that make sense?
Yes.
Okay, so just because you have a viral infection doesn't mean no antibiotics. It means, like we were just talking about, Megan, you've got to treat your patient. You got to understand what they have and what's going on. Okay? And if you do have a secondary bacterial infection, you need to treat that with antibiotics. Okay. There's acute and there's chronic infections. Acute means it's very quick, comes on rapidly, short-lived. Okay, acute, you get it now. Chronic means it's been going on for a long time. It persists over a long period of time. Okay. So here's your patterns. These are localized, where it stays to one area. Like in your armpit, you have your lymph nodes there. You can stay in that area. Or systemic, like influenza. Okay, localized infections like a boil or an abscess. It stays to that one area. Systemic infection like influenza goes through the bloodstream into the whole body. And it can go through the bloodstream or the lymphatic system. And you get multiple microbes, different types. That's why you culture if the patient is getting better and you know what microbes you have, what's going to work. Primary infection, bacteria. Secondary infection can be a yeast infection, can be caused by that. So a primary infection can cause a secondary infection. A different type of microbe can develop in a different area. A sign. Remember, signs and symptoms of disease. A sign is an objective evidence, okay, as noted by an observer. Sign looks like you're pale, okay. You're shaking when you do things. You're seeing it by an observer. Someone's seeing something. They're seeing you sweat when it's not hot outside. That's an objective evidence. It's something that's observed. The symptom is subjective. Like your temperature went to 101.3. That's subjective. Okay. When we cut into the boil, pus comes out. That's a symptom. Okay. It's subjective. It's there. Okay. So this is sensed by the patient This is sensed by an observer. So a sign is something someone else sees. A symptom is what is seen by the patient. It's something that's subjective. Common signs of infectious diseases. The sign would be a fever. Someone can tell that, right? The symptom observed by the patient is the chills. You shake. Okay. Septicemia. You can notice bacteria in the blood. Symptom would be pain, irritation. Microbes in tissue fluids that should be sterile. You notice that? Nausea, abnormal chest sounds, malaise, fatigue, skin eruptions, like both, could cause a centipede chest tightness. Leukocytosis is itching. Leukopenia causes headaches. Swollen lymph nodes cause weakness. Abscesses cause abdominal cramps. Tachycardia, which is an increased heart rate, can be anorexia, loss of appetite. One of the symptoms of it. Antibodies in the serum could form from a sore throat that the patient has. Okay. So the earliest symptoms of disease, okay, are going to be fever, pain, soreness, and swelling. Those are the earliest symptoms. That's what patient's going to experience. Okay. They'll have a fever, pain, soreness, and swelling. Okay, signs of inflammation. Inflammation occur with disease is edema, which is edema is fluid being accumulated. That's all edema is, accumulation of fluid. Granulomas or abscesses. These are walled off collections of cells and microbes. So the body finds the bacteria and they wall it off, they seal it. Okay, that's an abscess. Lymphadenitis or swollen lymph nodes. Okay, if you go to a lot of times when you have the flu or you're right under your mandible here at the angle of the mandible, you place your fingers there, you'll feel your lymph nodes. Now, this is where you get a lot of swelling sometimes when you get sick. Those are your first signs right here. Okay, this is one of the common lymph nodes where oral cavity, where a lot of food and bacteria come in through your lungs and into the oral cavity and nasal cavity. This is where it drains into the lymph nodes right there. And you get those swollen lymph nodes, your cervical lymph nodes right there. One of the signs that you're of inflammation. Okay. There's certain signs of infections in the blood. We talked about septicemia. When the microbe gets into the blood, it changes in the number of circulating white blood cells. Remember, white blood cells are our immune response. They control our immunity to different things to fight infection. When we get an infection, our white blood cells increase because we're going to fight the infection with them. So leukocytosis is an increase in white blood cells. Leukopenia is a decrease in white blood cells. Septicemia. Septicemia is bacteria in your blood. Those are microorganisms multiplying in the blood, and they present in large numbers in the blood. They're traveling throughout your body. Bacteremia, there's small numbers of bacteria present in the blood, not necessarily multiplying. You have bacteria in the blood, but it's not a septicemia. It's a small invasion. And a viremia, small number of virus particles are present, not necessarily multiplying. So septicemia is when you have a whole lot multiplying and you're in big trouble. That you got to respond to it somehow. Your body's not going to survive it. Bacteremia is there's smaller bacteria in the blood, but it's not clinically significant yet. Viremia is where there's some viruses, but they're not necessarily multiplying in the blood. Right? Infections that go unnoticed. It's called asymptomatic. Symptomatic means you have symptoms. Asymptomatic means there's no symptom. It's subclinical. Okay. So it's common for an infection to produce no noticeable or typical symptoms. Sometimes you're sick, you don't know it. Okay. Okay. Although you're infected, the host doesn't show any signs of the disease. So in a pair of infections, the patients experience no symptoms, so you don't seek any medical attention because you don't know you're sick. That's asymptomatic. Okay. So then we've talked about the portals of entry. Now we've got portals of exit from the infection. Okay. Pathogens depart by specific avenue, greatly influence the dissemination of the infection. Okay. It can depart through the lungs, respiratory, or it can pass through the salivary ports, okay, through the saliva. You can go into the mucus in the lungs, and you can cough it up. The sputum, you can spit up in the lungs. Nasal drainage, when your nose runs, or saliva. Okay. It can go through epithelial cells, like the skin and the scalp, following the sweat glands. It can escape through there. Fecal exit in fecal matter, urogenital tract, the urine, and removal of blood or bleeding when the body bleeds. it can be removed that way. So here's your portal of exit. Feces, blood, we take blood by example, urine, skin cells, open lesions, coughing, sneezing, insect bite is a way of opening up for the area through the skin. Okay, so presence of microbes and pathological conditions. Okay, so recovery of the host does not always mean the microbe has been removed. It could just be that it is latent, like we talked about with herpes. Herpes is in your body, it's in your nervous tract, and it's going to stay there for the rest of your life. It lays latent. It doesn't, just because you've lost the lesions on your lip or on the roof on your intraoral in your mouth, doesn't mean the microbe is gone. Okay, herpes lives in the immune system, in your nerve tract. It's never exposed to your immune system. So it's never going to go away. You can have it for life. Okay, so latency, we talked about latency, is after initial symptoms in chronic diseases like herpes, the microbe can periodically become active and produce recurrent disease. They may or may not shed it during the latent stage. Okay, so the disease comes out, follows that nerve tract, and it expresses itself. And remember, the things that bring out herpes are sunlight, stress, chocolates, and peanuts. Those 4 things tend to bring out the herpetic virus from its latent stage. Chronic carrier, person can be a latent infection who sheds the infectious agent. You can carry the disease and never know you carry it. Okay? And you give it to someone else. Sequel, long-term permanent damage to tissues or organs. The sequel to it is you can have permanent damage from having it in latent condition, living into the tissues. So epidemiology is the study, okay, of diseases in the body, okay, in human populations. Study how diseases distribute themselves in our populations. It involves many disciplines. It's not only microbiology, like we talked about, it's anatomy, physiology, immunology, medicine, psychology, sociology, ecology, statistics, how things are. So all that's involved in the study of diseases, how they distribute themselves in our population. And that's epidemiology. It considers many diseases, okay, other infectious ones, heart disease, cancer, drug addiction, mental illness, all those are considered in epidemiology. They're diseases that affect humans in our population. Reservoir. The reservoir is a primary habitat of pathogens in the natural world. Okay, human or animal carrier, okay, soil, water, plants, whatever the habitat is where this microbe is living is your reservoir, the primary habitat. The source is an individual or object from which an infection is usually acquired. How you contact a disease, malaria, the source is a mosquito. Okay, the bubonic plague, source is a rat. The flu, source is other humans. COVID, source is other humans. Okay, it's an individual. It's where the infection is acquired from. Okay, so you can have living reservoirs where, okay, the microbe lives in a primary area where it's feeding inside another organism. You can have a carrier who inconspicuously shelters a pathogen and spreads it to others. That's a carrier. You can spread it to other people. You can have an asymptomatic carrier where the carrier shows no symptoms, or you have what's called a passive carrier, like a contaminated healthcare worker transferring from one patient to another. In other words, if you're a healthcare worker and you're working on a patient who has a disease and you don't wash your hands and go to another patient, you can transfer that disease that one patient had to another one. That's called a passive carrier. Okay. Asymptomatic, you're carrying the disease, but you feel fine. You can jump rope, you carry normal activities. You have no symptoms whatsoever. Okay, passive we talked about. Remember we talked about passive transfer from a living reservoir. If you take care of one patient here, if they have that certain disease, you can take that, we use it, and then we touch this patient, we can transfer the disease to that patient. That's through contact. So infectious agent is spread is a passive way through a healthcare worker. Okay, in the living reservoir, the primary place where these microbes can live. Okay, you can get incubation carriers. You spread the infectious agent during the incubation period. When the virus is active, just like with herpes. Okay, if you have an active lesion on your lip, you can spread that to other people. When there is no active lesion, you cannot spread it. It's during the incubation period where carriers can spread it. Convalescent carriers are recuperating without symptoms. Okay? Convalescent means they're feeling better now. So recuperating has no symptoms. Chronic carrier, individuals have this infectious agent for a long period of time. Acute is very short, chronic is for a long time. Okay, so the different stages of infection, you get incubation, while it's incubating. You can have when you're convalescent, you're feeling better, you can still transfer it, or chronically, you can maintain it all the time for a long period of time and transfer it. Right. So if a nurse transfers a pathogen between patients without becoming infected herself or himself, the nurse has acted as a what? Which one would that be? So when the nurse transfers it from patient.
Passive?
Passive, perfect. That is passive carrier. Animals as reservoirs and sources. Okay, so the vector is a live animal other than a human, okay, that transmits an infectious agent from one host to another. The majority of vectors are arthropods, like fleas, mosquitoes, flies, ticks, things that transmit diseases to humans. Some larger animals can also spread diseases, like mammals, birds, or some of the lower vertebrates. But biological vectors, okay, actively participate in a pathogen's life cycle. It's intricately involved with it. It's using the machinery of the cell for it to duplicate itself. A mechanical vector is not necessary to the life cycle of an infectious agent and just transports it. So in a mechanical vector, the vector can take the infectious agent, contain it, and then transfer along without getting infected itself. In a biological vector, the vector is infected itself. It's using its own as part of the transfer process. Okay, so you have biological and you got mechanical. Zoonosis. Zoonosis is infections indigenous to animals naturally transmissible to humans, called a dead-end host. So zoonoses are animals that are transmittable to humans. There's at least 150 zoonoses exist worldwide. I think 70% of all new emerging diseases worldwide are zoonoses. It's impossible to eradicate the disease without eradicating the animal reservoir. So you can't just treat the disease once it's in the human population. You have to eradicate the disease from the vector that it's coming from your animal reservoir, or else it's going to keep coming. Okay. These are different diseases, the primary reservoir, and the mode of infection, like rabies. Rabies is the primary animal is all mammals, and it's by a bite or aerosol. The hantavirus are rodents. Okay, it's airborne waste. Influenza is the flu, chicken or swine. Okay, airborne. Respiratory for birds, and my mosquito bite. Rocky Mountain spotted fever or dogs and ticks, and by the tick bite. Okay, so there's different diseases that are transmitted from a primary animal reservoir, and the mode of infection is by different ways.
Is the Rocky Mountain the same as like a Lyme's disease, or no?
Rocky Mountain spotted fever, I think, is different. I'll look it up though. I think Lyme disease is different. It's a different type of tick.
Oh, okay.
But I'll double check that. I think it's different. And anthrax, caused by domestic animals, airborne spores, or by cutaneous contact. The plague, or the bubonic plague, rodents, fleas, flea bite, aerosol. Salmonella is, okay. Animals, bird, it's foodborne, food poisoning. Ringworm is domestic mammals, cutaneous contact with the skin. Toxoplasmosis, cats. Rodents, birds, again, foodborne. Trichinosis is swine and bears. And remember, it was common a long time before ham was cured and cooked correctly. So a lot of religions banned ham because ham caused trichinosis. Okay? This is ingestion of the cyst of it, but cooking it gets rid of it. Tapeworm, cattle, swine, fish. Okay? Communicable diseases. When an infection host can transmit the infectious disease to other hosts and establish infection in that host. That's communicable disease. When you can transfer your disease from one person to another, that's communicable. A highly communicable disease is what's called contagious. The patient is contagious. A non-communicable infectious disease does not arise through transfer from one host to another. Okay? A non-communicable disease is when it occurs within the person. Their own flora invade themselves, or in contact with an organism in nature that is a non-living reservoir. You're not getting it from another non-living host. So direct contact or indirect contact. Direct contact is physical contact. You actually make physical contact with it, or find aerosol droplets by breathing it in. Indirect contact. Indirect contact, you pass from a host to an intermediate conduit and then to another host. You're not making direct contact with the host. The vehicle of the transmission pattern is inanimate material, food, water, biological products, or fomites. Those are vehicles for this transmission. Or it could be airborne, which is droplet or aerosols. Okay, that's what you do when people sneeze. Those are a lot of aerosols. Okay. How communications are acquired? Okay. Communicable infectious diseases, direct contact. Direct contact is kissing, sex. Examples of what's Epstein-Barr virus. Epstein-Barr virus is part of what causes a mononucleosis. Mononucleosis is when you get real sick, real tired. It's also caused a kissing disease. Okay. Respiratory. Okay. By direct coughing on someone, they get the droplets inside their lungs. Okay. Mother to child transmits HIV or syphilis, can transmit. It's a direct transmission. Biological vector, like the West Nile virus, malaria, from an insect. Indirect transmission, contaminated objects, inanimate objects. Could have the bacteria or the virus on an inanimate object that you come in contact with. Okay, food, water. Okay, salmonella, E. coli. Okay, droplets, secretions. Okay, influenza, airborne microbes. Okay, from rat droppings. Okay. Epidemiologists study the transfer of disease in the human population. Okay. Epidemiologists consider all kinds of diseases. They consider virulence, how many of the bacteria or microbe you need to cause infection, the portals of entry and exit, how it gets in, how it leaves, and the course of disease, what it does when it's in the body. They've also performed surveillance. Okay. Collect, analyze, report data on rates of occurrence, mortality, morbidity, transmission of the diseases. That's the CDC does all that, keeps track of that. Reportable diseases, you must notify the authorities. Just like cases of COVID, cases of AIDS are all kept track of by the CDC. Control is responsible for keeping track of infectious diseases nationwide to help prevent the spread of infectious diseases. Ultimately, the CDC shares statistics with the World Health Organization, and then you get a world tabulation for control it. Okay. So there's different frequencies of these different cases of diseases. You have the prevalence. The prevalence is the total number of existing cases with respect to the entire population, usually a percent of the population. The prevalence is 5% of the population have it. 10% of the population has it. Okay. The incidence is the number of new cases over a certain period of time compared to the general population. So you get 20 new cases a month, 500 new cases a year. It's how many there are over a period of time. The mortality rate, okay? Total number of deaths in a population due to disease. That's your mortality rate. Your morbidity rate is the number of people that have the disease. Okay, a lot of nursing quizzes, your NCLEX test, they're going to ask you to distinguish between mortality and morbidity. They are not the same. Learn those for your exam. Okay, mortality is deaths of people in your population. Morbidity is a number that are afflicted or have the disease. So understand the difference between mortality and morbidity. This is some of the influenza. This is the common flu. Okay, this tells you the incidence, how it increases. And this is the different weeks here. Okay. As the different weeks of the year, this starts in this is your flu season right here. Okay, so week at the end of December, October, November, December, January, to 12 weeks of February. So basically, you're talking about December through probably March. That's your flu season. You see the peak right here. This is when you get your flu shots. So you should be getting your flu shots around, probably around now or the next couple of weeks. They'll prevent yourself from getting the flu at this time. This is what the CDC does. It tracks this data so it knows what to do. Now, just because you get your flu shot doesn't mean you're not going to get the flu. Okay. What the flu shot is the CDC takes 20 of the most common flu influenza viruses. They predict what's going to be the infectious virus. They take 20. They make the strain to them. They inject that with you. If you get the 21st virus, you're going to get the flu. All it is a guess on the 20 most common viruses are going to occur. Okay? And this tells you when during the season they occur. HIV, they keep track of HIV by states. You can look at the different states here, and you can see this is greater than 30 rates of HIV per 100,000. This is greater than 30 in Georgia, the highest state with HIV. Can't see that. Well, there we go. Okay, you got Nevada, you got Louisiana, Florida. These are your next high states for HIV. Okay, it's some that are very high in it, and that's what the CDC tracks. Okay, there's different patterns of the diseases that occur. That's what the CDC is responsible for. You have an endemic occurrence, which is it exhibits a relatively steady frequency over a long period of time in a particular area. Okay, malaria is defined a particular area over a long period of time. That's an endemic occurrence. A sporadic occurrence is an irregular interval. They occur haphazardly. Okay, you can't put them down to a certain occurrence period. So you have endemic occurrences, but it's a specific place, a specific time, and location. Sporadic is just anywhere all over the place. Okay, this is an endemic occurrence. You see it occurs in a particular area. Okay, if the disease is occurring there, we have what's called an endemic occurrence, like valley fever. This is where valley fever is found. Those are the outbreaks. Okay, if you have a sporadic occurrence, you see cases here, cases here, cases here. You see they're not localized to one area, like typhoid fever. It's a sporadic occurrence. Okay, epidemic and pandemic. We've all had those terms thrown at us a lot in the last year and a half. An epidemic is prevalence of disease is increasing beyond what's expected. It's increasing past what we expected it to. That's an epidemic. It becomes a pandemic when this unexpected thing crosses continents. Okay, so it's an epidemic where it's just going beyond what we thought it was going to. Once it crosses a different continent, then it's called a pandemic. Okay?
So was coronavirus both?
Well, it's an epidemic where it occurs, and then once it crosses, it's called a pandemic. Pandemic is an epidemic that's spread through more than one continent. Most epidemics don't spread to different continents. It's usually confined to that area. But when it does, then it becomes a pandemic. So COVID is a pandemic. Okay, so it's epidemic in different continents, then it's called a pandemic. When it involves more than one continent. Does that make sense?
Yes.
Okay, so COVID started out as an epidemic, probably in China. I know there's lots of political back and forth where it is. So once it crossed into different continents, then it became a pandemic. Okay, so an epidemic occurs. You see influenza, this is the flu. You see large amounts here. It's spreading faster than we anticipated. It's occurring all over the place. That's an epidemic. And then once this crosses the continental barriers to different continents here, then it becomes called a pandemic. Like AIDS was a pandemic. It spread to different continents. Okay, so an outbreak is a small-scale epidemic in a limited area. That's an outbreak. We have outbreaks of disease. That's what the CDC does. We try to contain it. So an outbreak is a small-scale epidemic. It doesn't go beyond what we expect yet. So we have an initial outbreak. When it starts to go beyond what we expect, then it becomes an epidemic. When it travels to different continents from there, then it becomes a pandemic. Okay, a point source epidemic is from a single source that we can identify. We know the infectious agent. It's one source. A common source epidemic. Okay. All cases from exposure to the same source. It's not a single source, but we have a source we know, and that's a common source to all the infections. And we have a propagated epidemic, which shows sustained increase over time. It's propagating. It's getting larger and larger. It's being communicated from person to person. It's communicable. It's spreading. Okay, you can see different patterns. Okay, this is your onset. You got intermittent exposures here in this area. Then you got it starting to spread, and then you can see it spreading out even more. Okay, this is propagated. Okay, this just shows you the number of cases. So it's gone from a point source, which is one source there, and it started to spread from numerous sources. Then you have a propagated epidemic where it's starting to spread throughout. It's starting to grow. Nosocomial infections. Nosocomial infections are healthcare associated infections. These are diseases you get in a hospital. Okay? When you go in a hospital for, say, an appendectomy, and you get septicemia. Okay, streptococcal infections, SARS. Okay, all these are hospital related. So nosocomial infections they're called healthcare associated infections. They're acquired during a hospital stay. They're not what you came in there for. You come in there for a broken arm, you come out with meningitis. Okay, that's a nosocomial infection. It's from surgical procedures, equipment, personnel, exposure to drug-resistant microorganisms. Remember, we talked about this drug-resistant, these super infections because antibiotics aren't working. So where do these people go? They go to hospitals. If this infection is respiratory, if you're walking the same corridor that person, you're going to get that microorganism. Okay? So hospitals are a great place to spread infection because that's where people go that are really, really sick. Okay? Surgical procedures, sterilization techniques can break down. You can transfer from person to person if proper sterilization technique not being adhered to. Okay, the most common nosocomial infections involve surgical incisions and the respiratory tract, GI tract, the skin, urinary tract, and blood. Blood is your sepsis. That's where this all occurs at here. Gram-negative intestinal flora, like E. coli. Gram-positive bacteria, like Staphylococcus, Streptococcus, and yeast. So true pathogens, like tuberculosis, tubercular bacillus, salmonella, hepatitis B, and influenza virus, are all easily transmitted in a hospital environment. Tuberculosis is all respiratory. It's all through the air. Salmonella by food that comes in contact. Okay. Hepatitis B is extremely infectious because hepatitis B is in a endospore. It's very hard to kill those with sterilization. We talk about 2 to 4 million cases a year with 90,000 deaths strictly from people going to hospital and getting disease they didn't have when they came in. Okay, so we have 2 to 4 million cases every year, just the United States, and 90,000 of those die. And that's just from getting a disease in the hospital when you go in. That's a large number.
That is so scary.
It is. But you got to think about it. We're taking the sickest of the sickest, we're putting them in hospitals. That's where you go. And then a lot of people use the hospital emergency rooms like a stop-in physician appointment, because a lot of times your insurance only covers emergency visits, not doctor's visits. So if you don't need to go to the ER, don't go to the ER. You know, it's not always a safe place. But it's a scary number. And this shows the different prevalence of nosocomial infection. 10% are in the blood, 13% are urinary. Surgical incisions, 22%, respiratory, 20%. These are the big ones, respiratory and surgical incisions. Those are the big ones for nosocomial infections. Breathing it in. This shows you different levels of isolation that are used in the hospitals. Different precautions, interior precautions. We use gowns and gloves. Respiratory precautions, private rooms. Okay. When we have drainage, we use gowns and gloves, and they're required. Masks are not needed when you're draining something. Strict isolation. Some is very highly contagious. You know, private room, closed doors. Reverse isolation, same guidance for strict isolation. Okay. Universal precautions, you hear that term a lot. Universal precautions means if you have a patient coming into your clinic, treat them like they have a communicable disease. It's universal precautions. If you treat everybody like they have a communicable disease, you're not going to transfer it because you don't know. Okay, same with doing dentistry. When patients come in, we have universal precautions. We wear masks, we wear gloves, we wash our hands between patients, we use sterile instruments. We do the same thing for every patient. That way, if they are sick, we're treating them the right way. We're not transferring the disease from patient to patient. And that's called universal precautions. Universal precautions are measures to prevent the spread of nosocomial infections from patient to patient, from patient to worker, from worker to patient. It's based on the assumption that all patient specimens could harbor infectious agents. You treat everyone like they're infectious because the one you don't is the one that is. Okay, but you treat them with the same care. If your answer is not possible, okay, take measures to decant hepatitis infectious material later on. I mean, sometimes you can't. If you're in an emergency situation, you got a gunshot wound, you're not going to sit there and have universal precautions and watch the patient die, but you scrub up everything. Okay, sometimes you just can't do it. CPR, okay, you gotta do it. So the occurrence of Lyme disease, okay, mainly in areas where certain species of ticks live, we're defined as what type of disease? An epidemic, an endemic, sporadic, or pandemic. Okay, so it's in a specific area.
Epidemic?
Epidemic, it would be endemic.
Oh, endemic. Oh.
Endemic to the occurs in certain areas. Not epidemic means it's spread at a high rate that you can't control it. It's more than expected. Okay, it's spreading throughout and it's growing at a rapid rate, and then it hasn't spread to a different continent because that'd be pandemic. So epidemic is when it's growing throughout the area, throughout your continent. Okay, expanding at an alarming rate. Once it crosses the continent, it's a pandemic. Okay, this is defined as a certain area, certain species defined as a certain area, so it's not sporadic. So it would be endemic.